Hello, everyone, and welcome back to Recovery Corner. Very excited to be kicking off season 2. And you might be watching us now that we are officially on YouTube, and you can view our show, see our mugs and our guest now that we're up on YouTube. So hopefully you're taking advantage of this new feature. As always, I'm Candace Rose. I am your host, and I have my co-host here with me.
What's going on, Candace? It's me, Jesse Hayner. You finally see the face and all the gingerness, and I'm glad to be here with you guys today.
Favorite face. But yeah, as you can see, we have a full house today. So on today's episode of Recovery Corner, we are going to be discussing recovery-ready communities through the lens of young people in recovery.
Yes.
YPR has developed a blueprint that outlines the continuum of care and the resources needed to ensure the best chance for individuals to have a sustainable recovery experience. So today we have Miss Tara Moseley Hyde, Renisha Rudder, and Danielle Durkin Mckeever, who are all recent graduates from the American University based out of Washington, D.C. And these wonderful women conducted a policy analysis of the YPR blueprint with the support of American University's Public Administration and Policy Graduate Program. So they're here to share with us their findings. Welcome to the show, ladies. Let's start with some introductions. Tara, we'll start with you. Welcome back to the show. You were with us season one. Season 1. So tell us a little bit about yourself.
Hey everyone, my name is Tara Moseley Hyde, and I am the Vice President of Programs at Young People in Recovery. I'm also a recent graduate from the American University, go Eagles, and working along with these fine women here. And I will pass it off to Danielle.
Nice.
Hey there. So I'm Danielle Durkin Mckeever. I live in the Capital District of New York. I'm about 20 minutes north of Albany. I currently work at the New York State Department of Health as a senior program specialist in the Bureau of Program Implementation Enrollment within the Division of Health Plan Contracting and Oversight. So I directly work on healthcare insurance policy issues, communications, as well as state and federal legislative activity. My work directly involves with Medicaid managed care. Managed care is a healthcare delivery system that's aimed to give guided health services to people with the most complex conditions, and a large chunk of the population are people with substance use disorders. So I'm going to pass it off to Renisha, another recent grad of American University.
Nice.
Thank you, Danielle. So as Tara and Danielle stated, we are classmates. We worked on this project together as our practicum and graduated from the American University recently back in August. My current role, I am a digital inclusion coordinator at a Southeastern Indiana Regional Planning Commission, which is stationed in Versailles, Indiana. It's a little cute little quaint town in Indiana. Definitely different than what I'm used to growing up. I'm originally from Louisville, so it has been great so far meeting the people in the communities that I live in and work in right now. Really excited about this fellowship, trying to bring broadband infrastructure and digital inclusion to the regions. It's pretty rural where I am, or semi-rural in other parts. And it's really important because we need to close this digital divide. This, when people don't have access to internet, they miss out on internet is largely becoming less of a luxury and more of a necessity. So, we think less, yes, we like to have internet for gaming and entertainment, but we also, as we learned through the pandemic, need it for schooling, for learning, or for instance, like this connection to communities and resources that, we need to be able for lifestyle. important. So I'm really excited to be working on this initiatives and also very excited to be on this podcast today.
Well, thank you, ladies. I'm really excited to have you all on the show and just really appreciate the work that you've put into analyzing the YPR blueprint. It's such a good blueprint. I'm excited to share about it more.
Yeah.
But yeah, and especially just having allies, individuals who just support the recovery movement, doing what you can, because, as we all know, addiction impacts more than just the person experiencing it. So hats off to you ladies for really putting your best foot forward to help be solution makers in this whole realm of recovery.
Yeah.
We can try. We're trying.
Heck yeah. You guys had we'll talk about your policy analyst, and I went over it and I was like, this is really, really good. And I definitely want to get into that. I was like, who wrote this? And it was our guest. I was like, this is great. So hats off, kudos to you guys.
Thank you.
Way to represent, especially with allies of recovery and people in long-term recovery, just a broad spectrum and attacking the things from all ends. So good stuff, good work. We'll get into that. But first, we're gonna have a few questions for you guys, and we'll definitely bounce off each other and get some more insight from all three of you. And but first and foremost, I'll just start with Tara. A lot of this stuff is also YPR based and driven, I guess you could say. Correct me if I'm wrong. But can you explain, for YPR standards, what recovery ready community is?
Sure. So the YPR YPR recovery ready blueprint.
It's a hard word.
Was established a few years ago when we were actually asked to speak in front of Congress, and among a variety of other things. Young People in Recovery has been around since 2010, and through all of the different services that we had established at the organization, we kind of learned that working in silos doesn't work, right? So it's important and vital to have a variety of options and support mechanisms in place in order for someone to sustain long-term recovery. And thrive in their recovery, right? Like, we're not talking about like people just coming in and just finding themselves and then that's it, right? We're talking about like empowering them to their goals, their dreams, their ambitions, like what's going on, what can we do to really support you to thrive in your recovery? And in some of those things, we sat down with a lot of really smart people that I had never got the privilege of meeting yet. I'm sure I probably will one day. But these individuals had concluded that in order for someone to sustain and thrive in their recovery, they need 8 different things that we had identified, which are the following: prevention, access to prevention programs, access to treatment, harm reduction, judicial and law enforcement programs that support those spaces, as well as access to housing, equitable housing, right? So housing that meets the individual where they are rather than what we say that they need to be. Education, so folks that are continuing their education, whether that be something like getting their GED, or if they're trying to, get a graduate degree or go into that sort of programming, as well as employment and recovery support just holistically. So it was determined that these are kind of like the staples in the community that need to be established in order for that person to not only find recovery, right? Because that's very important. And prevention is also a really great tool, just to kind of introduce people to not abstinence necessarily, but to showcase that, you don't have to use alcohol as a social lubricant, among other things. So, having an established space for that, and then having access to treatment, because, that is a constant need across the country. But, again, this blueprint was established to kind of showcase the staple of the at minimum, what we need to see are access to resources in all of these spaces, because if you can't have recovery thriving without these things, right? So without access to harm reduction, without access to education, right? You can't have people thriving, and you can't have community thriving without access to these things. So that's what the blueprint pretty much showcases, is the need for these things. And then it also goes into a deeper step of what sort of resources that are that we suggest really that go into each of these spaces. So prevention is more like implementation of evidence-based prevention curricula. Treatment is just the availability of different treatment models, whether that's 12-step based and abstinence or medicated assisted treatment or recovery, equine therapy, artistic therapy, men and women centers, you know, a variety of different things, harm reduction, community first responders, Good Samaritan laws, access to safe consumption, supplies, among other things, again, judicial and law enforcement. This is more like access to treatment courts, recovery courts, or, you know, utilizing treatment over incarceration is a big one, especially, you know, to be more inclusive of different demographics across the country. Housing also, housing first coalitions, as well as like, you know, mommy and me and daddy and me programs for folks that are in recovery that have children and or married, right? Because I mean, just because you're married doesn't mean that, you know, you both can't find recovery at the same time. Traditionally speaking, it's always been, you know, you have to be one and then the other one has to, you know, and we know that that's not, you know, the best and most efficient way for folks to find recovery, right? So again, and I think, you know, the more that I kind of dig into this and scrape off the surface, you kind of see the reason and the need and the why, right? The why of this blueprint, because we cannot have a society thriving without the access to all of these resources. And I think that we can really see, you know, across the country, and I think, you know, a lot of us will speak to some of the data that we discovered and uncovered through our analysis, just, you know, what it means when this isn't available, right? And that's kind of what our analysis showcases is, you know, would these models work? And if they are working, how are they working? Or what does the data show? Does it show that it doesn't work? Does it show that it's not available? What does that mean?
Right.
So again, and that's kind of the blueprint that we have established, is just all of those resources among those 8 pillars.
Mm-hmm. Yeah, I love all the 8 pillars that are identified in this blueprint, because it is, you know, like there's not one path for any one person to, or everybody's needs are different, you know, like speaking from experience, I didn't necessarily need treatment for myself, but I did need like supportive housing. And same for other folks, like they may have a good job, but you know, they need better recovery support, making sure that it's like accessible to everybody too, because it can be like, I could live in a community where there's 6 treatment centers, but they're $30,000 a month, you know, like that's not equitable to everybody. I couldn't afford that. I mean, most people can't. So it's not only like having these conversations about like, these are sort of the 8 core components that some people may have, you know, access to some of them, but they need others, but also making sure again, that it's like equitable to everybody too. I know Medicaid has recently like started being billable for inpatient services. But that's still like, you know, not every treatment center is billing Medicaid yet. So there's like all these different components, like it's such a big issue, but at least having these conversations so that communities are aware that like, these are kind of the 8 things that you want in your community if you want folks to thrive in recovery. And then how do we get there? That's a bigger issue, which kind of leads me to our next question is like, so as far as the policy analysis of this recovery ready blueprint, what was the motive behind the policy analysis? And I don't know who was most comfortable. Maybe
it looks like Renisha's ready to go.
Okay.
Yeah.
Yes.
I can answer that. I feel like we all, first of all, we are not experts. We were just grad students. And so first, that was our first and foremost, was to present this as kind of like a literature review of the studies that, that are done by experts in this field and on these subjects, to present what they have found. That was first and foremost, our top motivation there. And then also to apply it to the blueprint, the Recovery Ready Communities Blueprint, and saying, okay, if YPR says, in their own experience and their own findings, that this is what it will take to make communities ready to be able to support people in recovery. And then here's evidence that is also suggesting that, what we're saying is right, or that there needs to be more studying done. Then here is that report on that. So that was it. And then also, of course, we want to be able to reach people. We want to get people thinking and ready to have discussions over this topic, over what solutions are there already, what solutions we have yet to implement or have yet to think of. What are we missing? Who are we leaving out? What do we need to be doing better to help people in recovery enter in recovery and stay in recovery, and how to help our society as a whole, also support these people, know what to do to support it, know what damages that process, and how not to do those things anymore. So quite a few different, things that we were trying to achieve there. But just hopefully that, number one, we present the evidence that we're finding from the actual experts, and that we get people discussing what, this topic and what needs to be done and what can be done.
Absolutely. And I love, I was going to point out before, after Tara was talking, the same topic, I love, Tara, you said the word continuum. It's like, there's a bad stigma today, nationally and worldwide, of what recovery is. I think there's a stigma on when you tell somebody, oh, I'm in long-term recovery, they automatically think, oh, you go to those rooms, right? Or you sit in that circle, right? When recovery is so much more than that 12-step model, right? And I'm not knocking 12-step. I'm a 12-step person. That's what I do. That's my flavor. It's worked for me, right? And I've done other things as well. But I think this continuum that you guys talk about with different models of recovery, and Terry, you listed a plethora. That's right. I'm using big words today on the podcast. A plethora of different forms of recovery. It is MAT treatment. It is harm reduction. It is inpatient. It is social, right? It is equity. It is housing. It is education. So it's like, I get really, I don't want to say bent, but for lack of a better word, recovery is just so much more than just the rooms, right? And so we want to make sure we reach that on a high level. We're talking, stigma campaigns, politicians, police officers, first responders, that know recovery is a continuum, and like Tara talked about. So you can elaborate if you guys want, or if Danielle, if you want to add anything to what Renisha was saying, please go ahead. Hit that mute.
A darn mute button.
There you go.
I
Welcome to
definitely
Zoom.
wanted to mention that I am a very proud and supportive ally to all people in recovery. Alcoholism runs very deeply in my family. My father was an alcoholic. He developed liver and pancreatic cancer. He later passed from the cancer caused by the disease. My brother is on the path to recovery. He's been sober for 4 years. A very close friend of mine. He's been sober for about 15 years, and he still attends weekly meetings, and he will always attend his weekly meetings. And I'm very passionate about giving support, definitely the knowledge sharing, but also really defending that definition that substance use disorder is a disease. It's not something that you choose to have. And I think that's the biggest obstacle, is this stigma that people feel that it is a choice to be this way, or you have that choice. But when it's hereditary, And even though I'm not in recovery, I can see myself at many times falling into
Mhm.
a type of path that my family has gone into. So I, you know, I have to be aware and conscious. So I truly believe it's a disease. Doctors believe it's a disease. So I'm defending that definition.
Nice.
Well, thanks for, being vulnerable and sharing that about your family. And I think that really highlights that addiction impacts the whole community. It's rare that you meet somebody that doesn't know somebody or is somewhat closely connected to another individual that has experienced substance use disorder, whether it's family, friend, or an employer, an employee. It seems to be like 2 degrees of separation. And so really just shedding light on like our communities need to work together.
And I also will say that I don't have enough experience with someone that isn't on a path from alcohol. I don't have experience with a family member, someone close suffering from substance use, from like recreational drugs or, something else along those lines. But I can only imagine how much harder it is since, there's no heroin bars. There are bars where you go where it's in their face at all times. It's in restaurants. It's now being served in Starbucks. Like you cannot escape it. And how is someone supposed to stay where they are when it's like advertisements in their face all the time?
Mhm.
I can't imagine what that person must feel.
Right.
Danielle, that it's so crazy that you bring that up, because that reminds me a lot of when I was doing the research on the education section of our paper with the high school recovery communities and the collegiate recovery communities. And just that one of the books that I had read was talking so much about how alcohol as a culture is so normalized in probably Western society, but we'll just specify the United States because I don't have an experience in another country outside of the US. So I'm not sure how it is in Europe, but for US, it's like almost like a rite of passage, that you're expected almost to, even though your parents discourage you from it, but when you're in high school, you're expected kind of to go to those crazy parties where they'll be underage drinking. You're expected when you get to college to go, whether you're actually of age to drink or not, you're still expected to go to those college parties where there's going to be heavy drinking. And so, yeah, you're so right. It is all in your face. And how do we support, not just, it's bad enough of a problem for the people who maybe haven't identified whether they're in need of a recovery lifestyle, but also for the people who have identified that they're in need of a recovery lifestyle or trying to live that out and just have that shoved in their face all the time as they're trying to be a part of a community. Because let's face it, peer pressure is so effective. We try, we tell kids, oh, don't give in to peer pressure, but that's just kind of that's how we're wired as humans. We communicate to each other about what we expect from one another, verbally or non-verbally through peer pressure. And so if somebody is in, a community that is not recovery friendly, and they're going to feel that pressure, even if nobody is overtly telling them that they need to engage in that, they're still going to feel that pressure. And how do we stop that, and help them be able to feel like they're accepted no matter what and at what point in recovery that they're in. And also stop pushing that, for as something that, you need to engage in to be considered a normal human being in this country.
Just to piggyback a little bit on when I was a waitress, we were told to push alcohol sales all the time. Like appetizer, you talk about this drink. Entree, you talk about this drink. dessert, you talk about those after dinner drinks, and it's like, why do we have to keep talking about it? If they want to have a drink, they will
Mhm.
order one. We don't have to keep throwing it in their face every time.
Yeah.
It's just this, it's this culture that we just have to keep.
Yeah, our culture, some of the things you were talking about earlier was reminding me of like just how in your face it is. I think a couple of years ago I was out at like Walgreens or something shopping for a Mother's Day card, and they had this big plastic wine glass that you could fit a whole bottle in the cup, and it said, "Because mom, it ain't easy." And I was like, why are we encouraging this behavior? Like, why can't it say like, I need to drink all this water? Because that's probably what we really need. It's like a giant glass of water.
As a new mom, I tell you, all of the memes and things that I see, like the mom or the wine and sip and yoga, or like, and I'm like,
It makes
how
sense.
can that be like good for you? Like, I just, and look, I'm not trying to bash people who engage in drinking or socially drink or
Right.
whatever. Like, that's, I'm fine. I'm a person in recovery, and I'm proud to be in recovery for, just over 10 years. And, thank goodness for me and my life and my family. And, I choose not to engage in drinking, among, other, substances. However, folks may need those, things for themselves. But I just don't think that, circling recreational activities is probably the best thing to do around alcohol, and alcohol consumption. It's just, because you're pairing a healthy activity with something that's really not healthy. Alcohol is not healthy. You can't argue with that. Hard
Right.
stop, right? Like, alcohol literally is poison. Like, that's what it is. But kudos to the winemakers and to all those people that do that. And there's people that do that for fun, that just want to like have wine tastings, which is great. But I just think that, just because I'm a mom doesn't mean that I need to go have wine and do yoga. It is hard.
Wine tasting.
Being a
I don't
mom.
know how you taste wine. I mean, wine gulping. I don't know.
Right. I just don't understand it though. I mean, it is because, and then just as another highlighted point to Reneisha, and a tipping of the hat about education and creating these spaces. In my community, they're burying a student who just died of binge drinking at a local university, like last week.
I heard of that. I read that.
Because
That's
of
so
binge
sad.
drinking.
Yeah.
And that was just
Freshman,
showcased on the
right?
news like just the other day. I'm sorry.
It was a freshman, right? Or a sophomore. It was
yeah,
was
at a fraternity,
Yeah.
at a local university, and now his life is lost and cut short.
Yeah.
As a result of that. So and that just goes again, like, it just continuing. And you talked about peer pressure, and I want to take a step back, because there is another way, right? And I'm a big pusher and advocate of this. Like, there is a thing called positive peer pressure, right? And I was a big advocate for that, right? I was in community college because I needed some additional steps and support coming into college, and I'd ask plenty of fraternity and sorority folk and my peers and everybody that I encountered, because I didn't care. It didn't matter to me if you were in recovery or not. I mean, for those that were in recovery, great if you came and had fun with us and went to our fun events. But even better if you weren't in recovery and you wouldn't even hang out, just because I needed like people and support, and so we invited just everybody and anybody to come and hang out, play ultimate glow in the dark frisbee at the waterfront in Louisville, Kentucky, and that was the thing, that was life. And we had so many people that would just come, just wanted to have fun, not drink, don't engage in alcohol, but just come play frisbee and join the sport and go home, go to school the next day.
That's a great point,
not
Tara. That's a great point, is that to be inclusive, because sometimes when you say, oh, it's a recovery event, they say, oh, I'm not in recovery, I'm excluded. I think we want you to come. If you're not in recovery and you want to have a good time, come out and have a good time. I think you brought up a really valid point. We had a bowling night, and we had people who were not in long-term recovery come, and they had a great time. So sorry to sidebar you. I just wanted to.
I think that's a great sidebar, honestly. I think that's a great point to add on to there. And the thought ran through my mind, like as Tara was speaking, just, as an ally, which I am, I'm not a person in recovery. I am ally. I have friends who have struggled with substance use and are currently, in recovery. And my best friend, she's been in recovery for, I think, about 7 years now. So, it's like, as a person who doesn't have that struggle, I think sometimes it is, I have to do a better job of being aware of when I might inadvertently be creating or putting my friends in recovery into situations, or inviting them into situations that are not supportive and might make them, maybe uncomfortable. I know, because honestly, to not have that struggle is a privilege. In any kind of, in all relationships, really, you need to be aware of how, what privileges you have and how that may affect the relationship that you have with others, and how that affects your perspective that you have with others. And so for me, I think as an ally with family, with friends who are in recovery, or other allies out there, we should think like, what is it that we're taking for granted, that we don't have with the struggle, and where are we privileged, recognize those. And the fact that, we can just go to these, just out in the public and not feel stressed over that, and not feel pressured, and not, whatever the struggle is. And can we change our thinking? Does everything have to be centered around alcohol? No. And should we feel like, something is being left out if alcohol is not included in that event, or, that fun thing that we're doing? No. And how can we be more supportive for people, who do live in recovery, and make sure that we're not, again, adding any undue stress, and just kind of be more aware as a society, I think.
Yeah. Tara, what were you saying before I just blatantly cut you off?
No, you're great. You're great. I think this was a great conversation. I think actually that kind of is a great segue right into our policy, because that's exactly all of the pieces that we were highlighting in our analysis are like, how, do these components and the pillars in the Recovery Ready Blueprint, how does that fit into society to really help elevate and celebrate recovery and help folks to enhance their recovery experience and thrive, right? And our communities thrive. So, and I could talk a little bit about the area that I focused in. For the analysis, we each kind of took, we only ended up analyzing 4 pillars. And that was because, as you guys can imagine, and as we kind of like discussed earlier, the 8 pillars are a lot. There's a lot of pieces. You would still be working on them.
You would still be working on them today if you took 8 pillars. So good job on the 4.
Exactly.
This whole season 2, like, is just going to be us talking about this policy analysis, because there's, look at, we haven't even hardly gotten started. We just like tip of the iceberg, and look at our conversation. Like, this is a big topic. So,
I'm holding back, by the way. My brain is going 30 different directions. So this is Jesse holding back. So you're welcome. So continue.
Yeah, no, and that's so true though, right? Because there are so many pieces that kind of fall under each of those pillars that, could take months to really like dive into. I know we had the privilege of working on this for what, guys, like a total of probably 16 weeks, but really 8 weeks was when we really dove in, because we spent 2 classes and we did like a little bit of a fast tracked program that we were in. But nonetheless, we spent a monumentous time just, diving through research, reading everything that we can find about just the different areas and spaces, and all of just the research really about our different topics. So I can talk a little bit about the space that I researched, which was harm reduction. That was the pillar that I felt, honestly, that was the pillar that I felt most passionate about, that we really needed more research and really like more research to understand the reasoning why we need harm reduction services across the board in our country. And obviously, I'm in Kentucky. I don't know if I said that earlier or not, but I'm in Kentucky, and we were actually one of the first states in the southern region of the country to implement harm reduction services across our state. So I know it's pretty amazing. It was in 2016 when we passed a bill that gave access to naloxone, syringe exchange services, the Good Samaritan law. So like a lot of different services that, Kentucky had never had before.
And
But also
how could they not? Because didn't you guys get hit pretty big with opioid, like pretty
yeah,
big?
we had we were number 2 for a long time, and number 3 also for the highest rates of overdose deaths in the country. We also have we were number 1. I think we're still up there at 1 or 3 for the highest rates of hepatitis C. And some other illnesses as a result of syringe sharing. So, and that really led to, some of these expansive laws. So, and it was a double-edged sword, right? Like, thank goodness, but at the same time, it really sucks, right? Like, we definitely don't want to be number 1 in this area. Like, out of all things in the universe, this is what we're number 1 at. So it was a very unfortunate thing, but at the same time, thank goodness that we were able to expand these services. However, that kind of also leads into like some of my findings, right? So one of the things that I found in my research was that access to naloxone is so different and various across states. I think there was like 47 states that have access to naloxone. However, they vary like the accessibility, right? So some folks can go into any like CVS and get Narcan. Yay for you. Not everybody has that. Some people actually have to go to a doctor and get a prescription, and that's the only way you can get it. Some people, there are only a couple of states, and I don't have them in front of me at this very second. I wish I did. A couple of states don't have access at all. So, you have to go through several different hoops in order to get access. You also have states that you could get Narcan from community organizations, right? So you have like a standing order that a doctor, basically signed off, and that community organization, like a harm reduction coalition, for example, can dispense naloxone. So there's still some hoops, like you have to have a doctor that will sign up, et cetera, et cetera. So there's still a lot of barriers, right? Because people have to go see these organizations. They can't just go to the pharmacy. There was only a handful. And when I say a handful, I'm saying like maybe 13 states that had access to naloxone just by walking into a pharmacy. But most other states, you have to be trained. You have to have some sort of doctor that would prescribe it. Or something, like that. So there was still a lot of barriers to access to Narcan there. And as and as we've discovered in the last, few months, the CDC came out with a report that said, over how many people that had died last year, was it 93,000, I think. I'm sorry, I'm blanking on the number right now. But there was.
I will fact check in just a sec.
I appreciate that because there's so much. But there were, the amount of lives that were lost, and the lives that are lost right now. I have lost at least 3 people that I've known in the past week, y'all. And
Wow.
people that, an accidental overdose that was completely accidental. Could have been reversed if they had access to Narcan. Thank you, Candace. 93,000. I thought that's what it was, but I wanted to make sure I didn't want to misstep on that, because those lives are important. Those lives are the reason that we have these discussions right now, because they shouldn't. It was completely accidental and could have been reversed, right? Like these are.
And why harm reduction is so important. Like,
Yeah.
I want to say, I don't want to cut you off too long, but like, I think there's some good work being made around reducing stigma around recovery and addiction, but like harm reduction is very stigmatized. And
It is.
you know, like for a lot of people, they need treatment to get better. Has anybody navigated healthcare? It's hard. Like it takes time,
Yes.
and we need to have ways to keep people safe while they navigate into the systems of care that are going to support them in sustaining their recovery. So if they need access to syringes and access to naloxone, like we need to support that so that they can stay alive while they, because it's like you don't just wake up and you're like, I'm going to go to $30,000 treatment today.
Right. And not just that, but like people can't recover if they're dead.
Right.
That's it, you know? And I mean, and it is just that cut and dry. Because, you know, our society, as we just discussed, right? All of the pieces that makes up our society and the societal peer pressures and just the culture, you know, it isn't built to empower recovery or empower holistic health, right? A lot of it centers around a lot of really unhealthy things. So how do we support people that are in this sort of space that have these needs, right? And harm reduction really helps to give those stepping stones to increasing safety, increasing health, and keeping them safe until they are ready, until they can find recovery, until, you know, they make that decision that, you know, now is the time, or, you know, whatever it is for that person, you know,
Right.
and at the end of the day, it's just about keeping them safe. And also, and there's a lot of other like community components that, you know, really showcase how harm reduction is effective at saving lives, keeping costs of healthcare down, community, emergency use. So like having places like safe consumption sites, which are completely illegal and banned in the United States. You know, there is so much research outside of the United States, because it's illegal here, that show that like the use of emergency vehicles, which are so expensive, by the way, that like they'll decrease by like 63% around just in the general vicinity of those places that have safe consumption sites and safe consumption services. Like, like 63%. And I mean, you can't even like wrap your mind around it. That means like over half of the services that was getting reported is no longer reported because they are receiving those services at the site. So that means 63% of less people are dying, you know, like, can we wrap our minds around that number? Right.
Right.
So, I mean, that's like, it's just a huge thing, but yet they're banned in the United States, right? Because of, well, other things. So there should be more research, right? And case studies. And I know like that's such a hard thing, especially for like our politicians and policymakers to wrap our minds around, right? Because these are things that are, they're not sexy, you know, and they're not things that you can like really stand behind and have a lot of passion about politically, because it is very controversial. But at the end of the day, like these are people's lives, you know, and they have a data-driven history of working, right? There are things that we have in place in this country that don't work at all. Data shows it doesn't work at all, and yet it's still in place. It blows my mind. And there are some prevention programs that I won't say directly, and maybe I should, but they don't work. Like data has proven that, in fact, it actually harms people, doesn't help people. But yet here we are, and they still use these programs, and you know, but they're not effective. So what are the things that we can do to help advocate for these policy changes or for these pilot projects or whatever, right? Like write your policymaker. So like, and I know, again, right, safe consumption sites are very controversial, even in the recovery space, advocates and allies, because people don't understand it, right? And here's the bottom line, like people are going to use, and that's what's going to happen, right? We have shifted some viewpoints and some understandings of stigma, like how stigmatized harm reduction and Narcan is, for example, and syringe exchange sites. And now people have seen how effective those things are, right? Like how HIV rates have decreased, how hepatitis C rates have decreased, how medical costs and like the medical costs within the hospital have decreased as a result of having like these services available, because people are no longer having like, infections and lots of different things that are like side effects of sharing supplies and that sort of thing, right? Like we've seen these decreases in these things, this data that showcases that we think these things work. But we're still really hesitant to make that like really progressive step into this new space of safe consumption sites or safe consumption facilities. But the data shows that, the impact of having these things in the surrounding community are huge. Right. The impacts are huge, right? Because then people will no longer just be, out in the street alone. People can receive services immediately. People will know where to go, where they can be supported, foster development, and ensure that there is emergency personnel available, right? And keep people alive. And they're not just going to be out in your local neighborhood, in the parking lot or in the alley or in the restroom at McDonald's. And I hate to say that, but that's true. Or, some of these other places, you know what I mean? Where we know that these instances occur, we know that they do, and they're going to happen. So why don't we create these spaces to where, there's this in-between space where people can go, they can be safe. And also like, whenever they're ready for help, they can get it. And they can get it right then. You don't have to wait, right? Like you just said, navigating healthcare is terrible. It's a nightmare. How can we streamline process? Well, guess what, guys? This is it. This is how you streamline. You take it to them, right? And
meet people where they're at, like quite literally meet people where
they're at. Quite literally. Yes. And it's so controversial again, but like I said, the data shows it's effective and it works and it saves the taxpayers so much money. Because then EMS, guess what? They're going to be going to the guy who, has, who unfortunately has a heart attack and needs emergency services now, instead of going to somewhere who someone is experiencing an overdose because, their family walked in or what have you, instead of going to those visits. Because guess what? That person is going to go to a safe consumption facility and there's going to be a nurse right there readily available if something were to happen, because otherwise, the other situation and scenario is going to happen. And they may not make it, EMS may not be there. And there's a whole, slew and ripple effect of that. So, and I know I've spent a lot of time talking about harm reduction, so I'm going to stop so that way we can talk about some of the other pillars. But, I really wanted to drive home that,
no, I get passionate about it. I lost my best friend to an overdose in my house in 2013. I didn't know about naloxone. I don't think it was really talked about, Like I get fired up about harm reduction because I would be so happy to have my friends here still.
Sidebar real quick. I gotta just say this. I do it almost on all of our meetings. If you're watching or listening, whether if you're in California, it's easy to get these services. Just real quick, if you have any questions, like how do I do that? I'm going to give you a 10-second. You can get these, reach out to YPR, find a chapter near you and see if we supply these. Our harm reduction center. It's super easy. You literally open it up. There's a kit right here. It shows you how to do it. This could save a life. It's as easy as a nose spray and it blocks the receptors. So that's a different topic for a different day, but go to YPR on social media, on Facebook, click on groups, find a group near you or a harm reduction center near you. And let's get you some trainings. We have trainings all over the every chapter. We do them all over. So if you want to do a virtual training, reach out to YPR. How can I get involved? If we don't have one, we know who does, and we can help you out there. That's all I want to say.
Absolutely. Thanks, Jesse.
Yeah. My bad, Candace.
No, it's okay. I was just really agreeing with Tara on kind of, because it is one of out of all the pillars, I feel like, our country is starting to have more compassion towards addiction.
Yeah.
Like, oh, that is sad. But then when we start to talk about harm reduction, people are like,
right.
It's like
right. I feel like
it's a tough
recovery is
one.
getting
So
more bipartisan. I feel like it's not a this or that aisle. I feel like finally we're making some headway to where both political sides are like, we have this issue. This is bipartisan. And so I will say we have gained ground, but we still have much ground to gain. I think you guys agree on that.
Yeah.
Well, so you all, this is going to be all season. But I do want to hear from both Danielle and Renisha. So I don't know, we'll just kind of go I know each of you sort of had topics that you really dug into. So I don't know, let's start with Danielle, with these 8 pillars, where was your focus?
So my focus was in criminal justice and the judicial system, specifically on rates of recidivism, because it's a revolving door. How when substance use does not end in incarceration, and the crime that they committed most likely stemmed from their substance use disorder.
And substance use actually happens in incarceration.
Yeah.
Jesse and I just had a podcast
I was
guest on.
We didn't touch upon the rampant drunk problem in jail and prisons, but it is around them, and it doesn't stop when you enter that realm. But these people aren't getting services at all, and so then they go immediately into detox, and they're not helped. And I found data that if your cellmate is suffering and they could have gotten a type of substance in the jail, your cellmate won't do anything if you're having a negative reaction or overdosing at all, because they are so afraid of the adverse effects that are going to happen to them in jail. Are they going to get more time added on their sentence? Are they going to get jumped by someone in jail because
Samaritan laws don't
it's
apply.
a lawless land and there's nothing to be done? And then we have these amazing drug courts that are supposed to help, but yet you have the population of people that go into that go into jail. It's not captured in the same way of the people who are selected to go into drug court. So if you have a substance use disorder and you're in jail, you're not automatically going to get into a jail that has some type of program. So you're not capturing the right people, and we don't know why. There's not enough evidence looked at. There's not enough data to understand why that's happening. What I really found that stood out to me was that if you are white, Caucasian, you are more likely to be selected for drug court just by being that race, just by not being Black or brown. Why is that? Black and brown people also suffer. Why are they not given the same shot as someone who is white or Caucasian? It doesn't match, and it doesn't make any sense, and it keeps this terrible cycle of injustice.
I'm going to give you some real data right now, and I'm Danielle. Here you go. I'm a drug court, DUI court as well. They have DUI court and drug court here in Sacramento. And I would say out of 30 people in my DUI and my drug court, 25 were white, 25 were Caucasian. So I'm giving you the clear data as somebody who was in there. You're absolutely correct. And I absolutely agree based off the evidence of my personal life. And yeah, that's the truth. As soon as you said that, I was like, Yeah, she's absolutely right. So thanks for that, and that's right. But how do we change that? What do we do? Do we bring it to attention? What can be done? What can we do?
Yeah, like what are the percentages of people of color that are incarcerated versus on these like rehabilitation?
And based off charges, programs. How much more time are you getting? I'm a testament. I'm formally incarcerated, and I share that. I don't mind sharing that on a social standpoint. And I can attest that some of my friends got caught with the same amount of substances and had less time than some of my Black and brown friends. This isn't like a conspiracy theory. This is actually happening, and so this is a whole different topic for a different day. Again, we can write an encyclopedia on it, but I'm letting the listeners know and people in my community and my circle know it's absolutely true. You can't argue facts. You can't argue data. You can scream until you're blue in the face, but the fact remains it's happening. And it takes conversations like this to bring awareness. And so
exactly. And just to, eliminate that point, right? Like Danielle was just talking about, like, the thing is that there isn't data that showcased some of these numbers, right? Like it just doesn't exist. Or
why not,
it's
Darren?
really
why
old.
not?
I know, right? Like, and my biggest thing is that, I'm an advocate for transparency, right? So like my tax dollars are paying for these centers and these programs. So where's it going? And that's what you can do, right? As constituents, write your policymakers. Hey, I want to know where my tax dollars are going in these jails and these centers and these facilities. Sure. I mean, we can talk about counties and stuff like that. But there's also the issues of like private prisons, which are a whole nother animal we ain't even getting into. Like, Renisha, heart to you, because I just saw your face. And if we are watching this on video in season 2, y'all will see it. But these are real, right? Like, and because these are, things that are supported and paid for by tax dollar money, constituents, that's what you can do. You need to start asking questions. And push for transparency and efficacy, right? Because we need to know like what's happening and why people are not getting the help that they need, especially when somebody does come in with a substance use disorder or is incarcerated because of what I say like symptoms of their substance use disorder, right? Like people are stealing. Well, they're stealing for a reason, guys. And I'm not saying that everybody who steals has a substance use disorder by any measure, but like there's something else going on, right? Are they homeless? Are they suffering from homelessness? Or, are they experiencing homelessness? Like what's going on, right? There's always going to be an underlying thing. And, some people, and some people break the law and I'm not arguing with that statement either. Right. But there's gotta be some things and some policies and some practices in place that help to really decipher and figure out what's really going on with some of these people. And I just don't think that we do a good job of doing it. And that's because we don't collect data. We don't try to figure it out. Instead, we just throw people in jail sometimes. And that's it. And especially when we have a society that doesn't show compassion. And we incarcerate and the drug war is the biggest perpetuator of this systemic problem. And with that, I'm going to pass it back to Danielle, who studied this area.
I just, I know where I'm just being conscious of time. I think the biggest message is, we need more drug courts. 100%. And you do need to contact your politicians. And the message is that this is a public health problem, not a criminal issue. Like that is the whole meat and potatoes of it. That,
100%.
That you gotta give help. Punishment is not going to work in this case.
Right.
So,
well, it's like,
the help needs to be equitable as well.
Exactly.
You can't leave whole communities of people out, because they don't, look like you or, whoever that you deem important. So the help that comes also needs to be equitable. My topics to segue to that while we keep our time. I don't really need to say much about housing because that to me, again, it's kind of under the umbrella of harm reduction. I think I talked a lot about housing first initiatives. And Housing First, for those of you who may not be familiar, is essentially just providing housing to people who may not be in recovery yet, that are a different stage in that journey, or at the beginning stage, the pre-stage, whatever label you want to put on it, that they're not recovered yet, and they just need a roof over their head, a safe roof over their head. You know, we our hierarchy of needs, we need 3 things: food, shelter, and, you know, and I forgot what the third thing off my head, but it's important. But we're gonna, you know, folks, we times first, people will think, oh, okay, so you're just given oh, I hope my connection's fine. Are you guys hearing me okay? Okay, just want it had a message that it wasn't stable. So
It broke up for a second, but you're all good now.
Okay, good, got it. So, you know, I think that some people think that we're enabling, you know, to put somebody who is still currently using into free housing. But, you know, what you don't realize is that that person, that is just one less stress thing that person has to worry about on their journey to recovery. They don't have to worry about the streets that are unsafe and whether they're going to face any violence while they're just out there, you know, just trying to survive and deal with this substance use disorder. And yeah, so like I said, there's just so much to go into that. I really encourage people to read the report about that. I also want to segue into recovery support, which is kind of thinking holistically about recovery in general and looking at recovery not as an acute treatment, not for something that is short-term and finite, but an open-ended recovery system, and that is going to last over that person's whole lifetime and offer individualized service over that person's whole lifetime, not just short-term detox. And then that also kind of requires society as a whole, again, to rethink what is addiction and how do we support people who are struggling with that and struggling to recover from that. How do we change, again, our mindsets, whether we are a person who is an ally or wants to be an ally to somebody who's in recovery, to somebody who's struggling with addiction? How do we change the way that we think about them, how we speak to them, what kind of programs we try to create for them, what kind of events we try to include them on, what ways can we support them that gets them less stressed? And again, it's just one less thing to worry about as they're recovering. And my last section was education. I mentioned it earlier with the high school and the collegiate recovery communities. And one thing that stuck out to me was that these programs are very successful. It made a significant difference for people in these, for young people in these school systems to have specialized support from peers who are also in recovery, from even their own professors that might also be in recovery, and helping them through their struggles. Hey, I know what you're going through. I was at that point in one point in my life, and here's how I got through it. You will too. Here's what we have to help you. You know, not to say that everybody knows everyone's experience, because everybody's experience is different and what they struggle with is different, but to have people that are still just, you know, so understand and have that like goal of just staying sober while you are learning, while you're trying to better yourself, become a professional, get jobs, get degrees. And not only did the studies, the data showed that those students did better academic wise, of course, but they also had higher rates of sobriety. Like that's amazing, you know, because some of the other studies in the sections, like for housing, for instance, you know, could show they didn't have any direct links to lower rates of sobriety. They could just lessen the severity of the addiction, which means that the person is using less amounts and they're using less often, but they're not necessarily going all the way into sobriety, whereas recovery school communities are showing that data, that it is a difference in sobriety rates there as well. So You know, I really enjoyed doing this project. I just thought it was wonderful. I was so grateful that this is the topic that we got to work on. I was glad. It also kind of felt like we were cheating a little bit because Tara was VP. So, you know, it helped, you know.
We did get an A.
Yeah, Tara does everything all the way. Like, yeah, there's no half-assing with Tara. It's like,
it was
I want to give a shout out real quick off topic. I want to give a shout out to Tara. When I first started here, you know, it's a shaky, scared little lead in Sacramento. I don't even think I met you on virtual yet, but you knew I was new. Tara knew I was new. I introduced myself, and she was like, "Let's go eat," and didn't even know me. So Tara, like, this is something that you don't just do like on video. Tara really engages people in real life. And so I remember after that, I'm like, this is the company I want to work for. When you have leadership like that, we sat and we had some, like, it was like a makeshift Chipotle, but it wasn't really Chipotle. But thank you for that, for the engaging and sitting down and eating dinner. We had a good time. And I love YPR. I love everything that YPR does. And so thank you, Tara. Those shout outs to you. But real quick, I know we're closing on time. I would love to just briefly discuss, and then I'll hand it back over to Candace. It's a passion of mine. You talked about it, Renisha, you know, housing first, that model, and why that's important. It's like, and then for me, with the Sacramento chapter, I'm really involved with TAY housing, TAY. That's transitional age youth here in Sacramento and California. I'm not sure what it's called in different states, but it's the same thing. And so they get services from 18 to 25. And it's a housing first model. It's called low border communities. And what that means is come as you are, whether you have a mental health diagnosis, whether you have a substance use diagnosis, whether you're at wherever you are in the DSM, right? Come on in. Here's housing. We have a little tiny house village. They made these little homes and tough sheds in the homes. And really the only AOD services they have is YPR. And so we've really hit these areas, but it's just so crucial with housing first. A lot of programs, they say you have to get and I'm going to paraphrase, of course, words matter here at YPR, I'm paraphrasing. We need you to have a week of clean time before we can even do an assessment before you come into programming. And it's just, it's a horrible thing to say. And every program has its flavor, and I get that. But I'm so glad at least we are now stepping into this portion where it's like low border communities, housing first. And then also once they get there, making sure that they have an outlet that we're just not housing to house, but we make sure we provide these resources. So if you want to, however you want to touch on this, some of you guys, if you have a housing first module where you live, or maybe you have a rapid rehousing, just talk about the benefits of that. Anybody?
I'm sorry, I can't speak to that.
Maybe you don't have them.
Yeah,
I mean, I can
just
speak
moved to where I live, so I am not sure yet.
It's okay.
I know I did read up upon a lot of the ones in California, like as I was the housing section. So,
and I'll say
you
too,
already know that. So.
I'll say too, you know, like it should, like a qualifier for housing shouldn't be whether or not somebody is in recovery or substance free. You know, I don't think that people should have their lives disrupted if they do have like a reoccurrence, right? So if somebody, you know, experiences a reoccurrence of use, that doesn't mean you should throw them out in the street, right? Because that just perpetuates the problem. Like that doesn't help them. That's just sends them packing, and then they're, you know, then they're even a worse like situation, right? Like everything is situational. Then you know they're out in the street. They may not have anywhere to go. They may have their stuff packed up in a box somewhere, you know. So I mean, it just it perpetuates the problem. And you know that's the reason why like these services, like we talked about housing first. Yeah, housing first is amazing. But if you don't have like the services that are in the recovery blueprint, for example, if we don't have like those other services that help to like support having the housing, and then if that person has a reoccurrence, if they can go into treatment, or if they can get recovery support, or if they can utilize harm reduction, you know, like there are so many different pieces that you need in order for that person to sustain and thrive in their recovery. Bingo. And if you don't have them, you know, then that's when, you know, we have these really archaic policies, like let's just throw them out in the street because they can't, it's detrimental to our program because this one person, had a reoccurrence, and then it can affect the other people, which I get. But like, let's be honest here. Like there are systems in place outside of that housing that person can utilize, and it doesn't require you to have to throw them out in the street. And that's, that's what it. And that's the society, that's the cultural norm that we have today. And it's very unfortunate that that's what it is.
Yeah.
Go ahead,
I can't
Renisha.
speak to anything in Indiana yet, because again, I just moved here, but I moved from Tennessee, and I do remember shortly before I left that there, and it was a big controversy because I'm not exactly sure if it was exactly housing first, but I know it was at least in the spirit of that type of model where there was a housing community built to house homeless people, and did not put stipulations, as far as I know, upon sobriety. I could be wrong about that, but I just remember them interviewing one of the residents there. And again, it was big controversy because this is houses specifically to house homeless people. And as we know, it's very likely that, a lot of these people probably had addiction, a struggle with addiction at some point, whether they were still doing it or in recovery. And the neighborhoods around them did not want them there. But I will never forget the lady just talking about just how having that roof just changed her life and how she was able to get back on track to take care of herself and take care of her health, because she had a lot of health issues before, but just being able to have a roof over her head that was paid for and was safe, just gave her the ability to take care of herself. And the study that I mentioned in our paper it was done in Colorado, but the number that it produced, I think it was like over 31,000 per person from a Housing First initiative that is saving taxpayer money. So multiply that, if that could be replicated nationwide, multiply that times the thousands of people, who are struggling with substance use. And I mean, that's so much money, and not to just save money just for the hell of it, but like, that means that that's money freed up to help us with other things that we need.
Right, exactly. That could be used in other spaces to support people in recovery,
Exactly.
And at the end of the day, guys, like here's my tidbit here, because at the end of the day, like, this is about supporting communities and supporting people, right? We're taxpayers, every single person. I don't care whether we live in some states where people may not get their right to vote back because they have felonies on their record or whatever. And there's like a lot of other stuff, right? But every person, if you have a job, and even if you don't have a job, if you get a disability, you are paying taxes. So we are all taxpayers here. So we have a duty to make sure that we are, able to have these services and get these services. And, and we're talking about creating communities that support people in general, for our communities to thrive. And that means that everybody wins, guys. Everybody wins. Right. Everybody wins.
Not just communities in the community, but communities in the community, like these places I'm talking about.
Right.
Just these communities. And I think, you said it right in the head, like making impact, in these places that, hey, the reason why they may be houseless is because maybe a substance use. Is that being addressed, and are they being offered support? I think is the main part and the main crucial piece of what we need to do in our private community. So we can keep talking about that over and over. I'm going to hand it back to Candace. I know she has a question. Yeah, go ahead, Candace.
I do got a question, but yeah, that's what I'm saying. Like, each of these pillars could have its own seasons.
Segment.
Maybe we should have done that, like a episode per pillar.
We might have episode 2, part 2.
Well, let's chat. We'll come back. I think we should come back to this, but yeah, we are running out of time. I just want to say, because I think it's important to say, and for people to hear, speaking to the amount of money that gets spent. Like, for instance, we have a high barrier shelter here where people can reside there for up to 6 weeks. They can even apply for extended stay, I think up to 3 months. Nice. But if they show up one time under the influence, they are removed onto the streets, and then they are not eligible for another 30 days.
Mm.
So what I see, what I've seen in the past, what happens with these folks, we live in Colorado. I live in Colorado. They get booted out on the street in the middle of February. It's freezing. These folks end up like intoxicating themselves to levels where they have to be seen at the emergency department and then admitted into detox. These are taxpayer dollars that are not being well allocated. That's our law enforcement, first responders going to like rescue these folks and get them into the emergency department. So it is like, you know, people are like, I don't want to spend my taxpayer dollars on low barrier shelters. It's like, you are paying your tax dollars. They are just not effective. Like, let's allocate them to more effective solutions.
And it's going to be more expensive on the back end.
It is like emergency services. Like I'm sure everybody knows going to the doctor is expensive, y'all. And you know, it is no different for people who do not have medical insurance. Matter of fact, it's worse. So, you know, and that's coming out of public funding. You know, that's where that comes from. So, and people wonder why the potholes aren't getting fixed. Well, let's talk about where your money's going.
Right. Yeah.
Street.
I just wanted to say that I tried to like say that to as many people as possible. It's like the whole argument of that these are my tax dollars. It's like, yeah, no, you are, you know, you are already spending your tax dollars this way. It's just, it's not solution. It's like a Band-Aid and really getting wasted. So, but yeah, we do need to start wrapping up. I would love to get you ladies back on the show. We'll have to like connect and maybe, because I feel like we only just barely breached the surface of the topics that we did get into.
We're gonna do it again. We're gonna do it again. Yeah. For sure.
But I want to ask, I'm going to ask this collectively, so maybe you can each sort of just like put your piece into it. But here at Recovery Corner, we always ask our guest, what does recovery mean to you?
I'll go first. So for me, it's a community that's thriving. Yeah.
Nice.
As an ally with the secondhand perspective of what recovery is, I think recovery is reconnection and reintegration in with the community that is fully supportive, and so that you can thrive. To piggyback off this.
There you go.
It's, you know, a safety net. It's support that if you have, you know, a relapse or something, that you're not looked down upon, you know, that this is a path and it's not linear, and people are human, and we need to be, number one, supportive and get them the tools that they need to have a sustainable life.
Very nice.
Very beautiful, ladies. Thank you so much for the work that you did on this project.
Yes.
And thank you for being here to talk about it.
1 second before we close, as always, Miss Candace, before we close, I want to give you guys an opportunity to shout out an agency or just anything you want to plug. Maybe you're like, check out me on my IG. I don't care, whatever, you know, whatever you want to plug. Plug a person, place, or thing before we close, or anything that you might be important for you guys. I'll start with Renisha.
Well, I'm going to plug what my current role is right now. And especially if you're listening and you live in the state of Indiana, go to the Indiana State website and look up the Indiana Connectivity Program. Register your community for that portal so that if your community, especially if you are in an underserved or unserved area, you register and get internet service providers hopefully bidding to go to take some of this government money that they're just shelling out there and give you guys some internet, and so connect you to our world and do great things with it. So yeah.
Good plug. Danielle.
So I'm gonna say, you know, I'm from the progressive state of New York, and I love the state that I'm in, and even New York is now changing, and one of the biggest agencies that we have is the Office of Addiction Services and Supports, which used to be called the Office of Alcohol and Substance use disorders. So the name is already changing, and it is all about addiction and service and supports. There's lots of trainings on how to administer naloxone, and you always have a friend in New York.
Nice.
Oh, I love that. Oh, and I guess I'm last. So I would say, well, number one, if there are university officials or teachers or harm reduction enthusiasts or housing first enthusiasts or anything, if you are looking for data and research, check out the youngpeopleinrecovery.org website. Our analysis is on the homepage. You just scroll down and look for American University report. That is us. It is well cited. And I hope that, folks utilize it because we did put in a lot of work and just to say, we are not experts in this field. However, we are research. And so we, did our due diligence and everything is cited. And, it was also overseen by American University. So, and their practicum team of professors and et cetera. And I work in this space, but nonetheless, I hope that this, this research and this policy analysis really gets used. So that would be my dream, because I think, we just highlighted so many things.
Right.
So please,
Nice.
please look at it. Look at the document. Look at the research.
Look at it.
And share it.
Yes.
We'll put a link in the show notes so that people can just click.
There you go.
Wonderful. Love it.
Like
Love
a
it. Well, hey,
play.
look, guys, I want to thank you so much. Renisha, Tara, Danielle, you guys are awesome.
Thank
Yeah,
you,
just
Jackie. You
love
too.
hearing all of it. And, with that being said, guys, we are wrapping up. That was a great show. Really exciting. I can't wait till it comes out. But we always close with this. Once again, guys, thank you for Recovery Corner for listening, whether it's on visual or just audio. I am your host from Sacramento, Jesse Hayner.
And I am Candace Rose. Remember, new episodes are available to stream every other Wednesday as early as 5 a.m. Eastern time. So tune in next time. As always, here at YPR, we do recover and we are in your corner. Thanks for listening.
Bye, guys.
Peace. Nice.